This is the Voice of Health, sharing health principles, inspiring healthful living, because a healthy lifestyle is medicine. Broadcasting every Monday, Wednesday, and Friday at 11 a.m. Brought to you by the Lifestyle Medicine team of Adventist Medical Center Manila, Health Ministries Department of North Philippine Union Conference, Adventist World Radio, and Hope Channel Philippines. This is the Voice of Health.
Masaya at malusog pong araw sa inyong lahat. Yan po ang pagbati ng programang ito na Voice of Health Pilipinas, Trumpeting Heaven's Prescription that Lifestyle is Medicine. Kasama po ninyo dito sa Hope Channel. At kami po ay walang sawang nagpapasalamat sa inyong patuloy na pagpapatuloy sa amin, sa inyong mga tahanan, sa inyong mga buhay. Saan man po kayo naaabot itong broadcast namin ito, sa radyo, sa social media at sa telebisyon. At muli po, ang ating pong mga nanonood sa Hope Channel at sa mga social media, kayo po ay pwedeng mag-like, mag-share, mag-comment. Sa radyo po, narito naman ang ating mga numero sa ating AWR 89.1 FM na tayo po ay malakas na napapakinggan. Ito po ang ating mga numero. Sa Globe po ay 0917-5643-777, 0917-5643-777. Sa Smart, ay ito naman po ang ating mga numero, 0919-0001-777, 0919-0001-777. Maaari po kayong mag-text dyan at magpadala ng inyong mga katanungan at mga pagbati at kayo po ay tutulungan ng ating mga AWR 89.1 FM na mga kasamahan. Bago po tayo magtungo sa ating espesyal na episode ngayong oras na ito, tayo po muna ay manalangin. Amang banal, kayo po na siyang nagbibigay sa amin ng kalusugan at ng mga pagkakataon. Ngayon po, nagkasama-sama muli kami sa pamamagitan ng programang ito, Tinig ng Kalusugan, upang matunghayan po muli ang mga natural na pamamaraan upang paano namin mas lalong pag-iibayuhin, palulusugin ng aming mga kalusugan at lifestyle. Samahan niyo po kami at gawin pong patuloy na pagpapala ang programang ito sa lahat ng aming mga tagapanood at tagapakinig. Ito pong aming dalangin sa pangalan ni Jesus. Amen. At kaya nga po, sa ating pagpapatuloy ng ating mga special episodes na kaalinsabay po ng 95th anniversary ng ating mahal na hospital, Adventist Medical Center Manila, na may temang Arise Missionaries for Christ Mission, ay pag-uusapan po natin ng isang interesting na bagay po. Ito po ay ang hydrotherapy. Yan. Hydrotherapy for common diseases, lalo tigit po ngayon sa ating mga panahong ito ng bahagi ng taon. Pero bago po yon, ay panoorin po muna natin itong nag-iisa nating letrang F sa ating lifestyle acronym, ang Food is Medicine, Fluid is Medicine.
F. Food and fluid is medicine. The taste of health and the thirst quencher. How long can you live with nothing to eat or drink? Several studies provide sufficient evidence. Plant-based nutrition involves eating fruits, vegetables, whole grains, nuts, and legumes. These kinds of food lowers your risk of heart disease, reduces risk of hypertension, helps in prevention or management of diabetes, prevents obesity and other chronic diseases. Water is among the basic needs for survival of humans, animals, and plants. About 2/3 or 60 to 70% of human weight accounts to water. Every cell, tissue, and organ of the body depends on water to work properly. flushes out the toxins and waste, regulates normal body temperature, supports skin health, facilitates good digestion, provides protection for brain and spinal cord from shocks. Therefore, whether you eat or drink, or whatever you do all to the glory of God. 1 Corinthians chapter 10, verse 31. Nourish more, abuse less.
Mga kaibigan, para po sa ating usapang hydrotherapy for common diseases today ay makakasama po natin sa ating special na edition na ito, episode na to, ang ating bisitang medical missionary na galing pa po sa Estados Unidos at siya po ay narito sa Pilipinas upang gumawa ng iba't ibang mga pagsasanay sa mga gusto pong matuto ng ating mga health messages and practices na kailangan po natin. At siya po ay merong ministry na tinatawag na Health and Your Everyday Care with a K, no? Because that is her family name, Hayek. And now we welcome to our program Dr. Julie Hayek. Hello, Dr. Julie.
Hello, good to be here. How exciting it is to be able to share these simple things with the people here in the Philippines, because really health is right at your doorsteps. They call them the 8 doctors. They're ready to come, and all you have to do is accept these simple little things and see how God can utilize these simple things in your life to help with disease, simple remedies, just like how water is vitally important for our system. Most people are dehydrated. So water is really important. And so we're going to be looking at some hydrotherapy treatments. And like the word says, hydro, well, we're talking about water.
Yeah,
so water treatments.
So before we give the time to Dr. Julie, do not forget, huwag niyo pong kalimutan, mag-like, mag-share, mag-comment. Share, so that many people will know and will watch and will be benefited with our program this morning. Ito pong ating talakayan ngayong oras na ito. Kaya po, pag tayo po merong panahon, ay dahil sa ating part 2 mamaya, ay makakakita tayo ng mga demonstration. Ipapakita ito kung paano gagawin ito pong mga hydrotherapy na ito sa ating mga tahanan. Now, let's give that time to Dr. Julie.
So first and foremost, we have to understand true remedies for disease, because there's going to be a lot of remedies, but what are the true remedies? And we know that nutrition is important because our body needs to be fed, the cells need to be fed, and so the food has to get broken down in order for them to feed the cells. But when we're looking at remedies for disease, we're looking at all of these things. I call them the 8 doctors, and they can visit your home because you probably have these doctors at home. The next thing is exercise. If we're not exercising, that's not a good thing, because God has created us with like 840 different muscles. So we need to make sure that we are exercising, making sure that we're getting our sunlight, because that's great vitamin D. We also make sure that we're drinking our water, because water is so vitally important. Making sure that we're temperate and doing those things that are good, but not overdoing them, and staying away from the things that are harmful. We need to make sure that we're breathing, making sure that that air is getting into our system, because a lot of times we're shallow breathers. And that can cause a lot of problems if we're not breathing properly, because our lungs need that exercise as well. We need rest, 7 to 9 hours every night, and we need a rest once a week. And that's why we like to talk about the Sabbath, because it's really important to take a 24-hour break every single week, not to think about work, but to be able to truly give your time undivided to God. And so trusting in God, because He's the one that can help us with all 8 of these things. So today, as we take a look at these true remedies for disease, there's 2 distinct features. Number one is they have or they assist nature in her attempts to eliminate the injurious agent which is causing the unpleasant symptom. And number two, they never leave an injurious influence on the body. That means if you're injured and you're using these natural remedies, the hydrotherapy remedies, or even your poultices, they're not going to have an effect that's going to be bad. It's always a positive effect, and sometimes we need to do it a little more often in order to get what we need because of the situation. So let's compare this with pharmaceutical or the pharmaceutical logic effect. This is where the remedy works in opposition manner from nature. It's not working from a nature point of view. It's actually working from the opposite of nature. So if nature is causing diarrhea, that means the pharmacological remedy causes paralysis of the bowel, meaning that it's going to stop you from having diarrhea, right? But in nature, it has to follow that effect, and it's getting things out of your system, and that's why you have diarrhea. So if nature is conserving the body heat to activate her immune mechanisms, then that means the drug acts to stimulate the mechanism for the dissipating heat, and the fever falls. So we have to understand what really is going on in the body when we're looking at the effects. So we're really looking at drugs or natural simple things and how that works on our bodies. Another thing is if nature is cleaning the respiratory tract by coughing, then the medication suppresses the cough center in the brain and it stops the cough. So it's the opposite. And all natural remedies, they stimulate and assist in the same direction that the physiological processes are going. So your physical reaction to these things, that's the process that is supposed to go in that direction, because the body is trying to expel this, whatever it is that's inside of you, and that's why we have these effects. So rather than using an opposite action as do drugs, we're going to be looking at how to look at the physiological process to fight disease, meaning that we're going to work with the body in order for it to correct everything. So then that way you're working with your body for it to be assisted in that health process. So this includes those that increase the immune response. It increases the ability of white blood cells to eat germs and foreign matter. It also increases cleansing flow of the blood both to and from the affected area or that affected part. Another thing is that it increases the elimination of toxins, waste, foreign substances from the body, working through the lungs, kidneys, skin, bowel, and it keeps the brain informed about the situation by causing sensations of pain, discomfort, itching, and congestion, things like that. So these are the things that are taking place. So the question I'd like to ask you is coughing, is that a friend or is that a foe? Now, how many people would say that it's a friend, and how many people would say that it's a foe? I think most people would say that it is not a friend, that it is a foe. Well, I would like to let you know that actually coughing is a friend. So why are we killing the messenger? So the messenger is saying, hey, something's wrong in the system. You need to cough this out, or the body isn't functioning right. Maybe you get a headache, and that's to let you know that something is wrong inside the system. And so the body is trying to expel this, and so this is what happens. And so when we think that disease is a bad thing, it's actually letting us know that there's something going on in the system that it needs to fight off. And so therefore, it's a cause and effect. If we're doing too much sugar, we're probably going to have a sore throat. If we're eating too much sugar, we might have a high of a lot of energy, and then we have a big low. So all these things have an effect. They play an effect. You drink too much water, or if you're drinking water like you're supposed to, Maybe you go to the bathroom a little more. You're urinating. Or if you're doing certain things, you're going to have a cause and effect. But we need to know that the body is actually working with whatever it is that's going on. So it could be either good or it could be bad. So first of all, I'd like to talk about hot foot bath. Have you heard of a hot foot bath? It's a true remedy for sure. It's one of those things that you can use pretty much anywhere. If you can't do a hot foot bath, sometimes you can do a hot hand bath. So depending on what kind of ailment is going on, this is what you would do for a hot foot bath. It can be used to reduce a fever, since it causes the number of circulation of white blood cells to be increased, and the toxins which cause an elevated body temperature are removed, and the thermostat restored to normal. So you're thinking, a fever bath, it can reduce a fever by using hot water to your feet? Yes, absolutely. Absolutely, that's exactly what it does. If a person has a headache, one thing you want to do is a hot foot bath. As long as you're not a diabetic or have neuropathy in your feet, you can do a hot foot bath. If you have neuropathy in your feet or if you're a diabetic, you should not do a hot foot bath. But what a hot foot bath can do is that it can combat a cold, a headache, or any congestion of the head. Now you're probably thinking, how can that work when I'm putting my feet in hot water and my problem is in my head, right? Well, the congestion in the head, whether it be a headache or a cold, or even if you have a chest, maybe a chest cold or your tightness in the chest, or even the pelvic organs, right? Like menstruation difficulties. By pulling the excess blood from that congested part, it means that it's going to increase the effect of the circulation. So where that area is having a problem, whether it's your head or your chest or your stomach area, what's happening is when you put your feet in that hot water, blood goes down to that area. That's why it is so key to understand the physiological part of how our body works. And so what we're doing is we're increasing the circulation. That means that when we increase the circulation, it's also increasing the white blood cells. Well, why is the white blood cells important? Because they are the military. They're the ones that's our immune system. They're the ones that go to work. They fight, and they're trying to fight off whatever that invader is that's inside the body. So as we get the blood circulating, now we can get everything normalized. So it can open up a totally blocked nasal passage of a person in about 5 minutes. Wow. How amazing is that? There's a measure increased in the flow of blood to the pelvic organs as well as to the structures of the nose, the throat, and the bronchi, which, or when the feet are placed in hot water. So it really does make a difference. I've seen people get rid of their headaches. One time I remember I was working at Country Life in Columbus, Georgia. It's part of UG Pines, and that's our health food store and vegetarian restaurant. There was a young lady that had a headache for 17 days. And she said, you know what? I think that place called Country Life can help me. So what did she do? She called up and she said, can you help me? And so I said, sure, I have just a short period of time. Everybody else left for the day. Come and I'll give you a hot foot bath. So I put her feet in hot water, massaged her neck and her shoulder area, and in 30 minutes, she felt a little better, but a half an hour after the foot bath, her headache was totally gone because she needed to also drink water to help with that flood of the blood going and circulating throughout the body. That night when I called her up, she said it was simply amazing. 30 minutes after that whole treatment, she felt great and she's still feeling good. So simple things like this can make a huge difference just by putting your feet in hot water. So how is it to do actually? Well, it's easy to administrate. And what you do is you have a deep container, such as a foot tub or a large wash pan or even a large trash can. Whatever you have that you can use, I would say use it as long as your feet can fit in there. You want to use that. I remember a friend of mine when we were at UG Pines, she was feeling really sick. She had a head cold and she wasn't feeling good. And I said, well, let's get one of these big pails. So we put some water in the big pail, and we had hot water in there. And I'm ministering to her this hot foot bath. And over a short period of time, she started feeling better. So what you do is basically you fill the tub about 3/4 full with water at about 110 degrees, which is 43 degrees Celsius, or about as hot as the person can tolerate it. So sometimes people may not be able to tolerate that right away. So what you do is you put a little less than that, maybe about 40 to 41 degrees Celsius. And as they're able to increase that, you'll be able to put a little more hot water. So the ordinary foot bath lasts for about 20 to 30 minutes. Not very long, very easy to do because you're just placing the feet in the water, and you're putting warm water in there to make sure that that level of that heat of the water stays at that temperature, or getting up to 110 degrees or 43 degrees Celsius. So you want to make sure that it stays at that level for a longer period of time, because the better that you do that is going to be more effective in being able to get that circulation going down to the feet area. During that time, the temperature should always be kept hot as the person can take it. So if you can't get it that hot, try to over a period of 5 to 10 minutes. So then that way you can get it up to that point. So the object here is to heat, to start out with where they can tolerate it, maybe 40 degrees or 40.5 degrees Celsius, and then build up that temperature during the next 2 to 5 minutes until you can reach about 110 to 115, which would be between 43 to 46 degrees Celsius. So when you're doing that, the feet should become quite red while in the bath. And so at the end of that 30 minutes, you're going to pour cold water over the feet to close off the pores, to intensify and prolong the action of the hot water. So very important that these are the things to do. Now you might want to say, well, can I do that? Would it be okay for my child? What are some of the contraindications? So if a person is insulin dependent, like a diabetic, you would not do it for them. Such as an individual may have serious hardening of the arteries to lower their extremities, and should not be treated with hot foot bath except under medical supervision. So you have to be very careful with that too. I would say err on the side of being safe, right? And of course, those who are unconscious or cannot feel heat should not be given a hot foot bath. If they can't feel, don't do it, because you don't want to increase any problems, because a lot of times if diabetics can't feel their feet and you put it in hot water, what's going to happen is they're going to get blisters, and now they're not able to walk. So you don't want that to happen either, because then now that's another problem, another sore, another problem that you're going to have to deal with. So it's better not to do it. So pain in the body parts, such as your head, pain in the chest, your abdomen, the pelvis, or even your skeletal system, your bones, you can use a hot foot bath. The hot foot bath can be used for infections, because what it's doing is it's getting circulation going in throughout the whole body. It's bringing circulation or all the way down, getting the blood down to the feet area. So that would help with the circulation everywhere else, since you might have your head is not getting good circulation. So that's why you would do that. A sore throat can be nipped in the bud, so to speak, like what we say, which means that the first symptom of something going on is when you need to treat it. If you treat it early, you can get rid of it early. So you want to make sure that if there's a sore throat, just do something quick like that. I remember when I was in England and we were doing some meetings there, one of the presenters, he was getting a sore throat. And so we did a heating compress around his throat, and it was amazing. He did it overnight, and we're going to show you how to do those as well. A heating compress, which you'll be amazed that you're using cold water. So, and you call it a heating compress. So I'll tell you a little more about that when we get there. Bronchitis or a cough can similarly be averted by the use of hot foot bath. And so those are really good things to do too. And many types of infection in the pelvis area, such as if you have problems with your, especially for women, since we have a lot of organs there, this is really important. If we have like poorly treated with treatment, if they weren't able to get anything to help them with medicine, which might end up creating more problems, a hot foot bath is the to-go-to in those areas as well, like menstruation and your ovaries and your cervicals and all of that. So when it comes to pregnant women, who should not be treated with the use of drugs except in life-threatening situations? They will often get relief from an ordinary infection in the pelvis area with a simple hot foot bath. And the reason why is because it greatly increases the circulation and to and from those structures of the pelvis, refreshing and healing the tissues. So very important. I mean, you know, if you're pregnant, or if you're a man and your wife is pregnant, you don't want any damage or harm to be done to the baby, the fetus. So you want to make sure that you're doing those things that would be helpful. And we know that drugs can maybe be an issue. So this is something that's going to be really good. So simply avoid cold feet will go far toward protecting a woman from pelvic infections or infections of the head and the upper respiratory tract. Now, you know, a lot of young ladies, they get cramps on their menstruation. And so you may be wearing shoes or socks and you're wondering, why am I still getting this problem? It could be because of the food that you're eating. If you're eating fried foods, if you're eating sugar, these things also affect our organs. And so the big thing is we got to get to the root cause. If we don't get to the root cause, then that means that we're not really reversing what's going on. Now, a lot of these things will help for a period of time, but if you are doing something that is not right, and you keep doing the foot baths and all this other stuff to help you, that means that you need to look closer at what truly is the problem. So another thing that you can use a hot foot bath for is sprained ankles. Treating with alternating hot and then cold, going back and forth between the hot and the cold. Formerly, we used only cold to an acute sprain for the first 24 hours. That's what we've all learned, especially if you're in the medical field. That's what we learned. This still remains a very good treatment for a sprain and will often help to reduce the swelling, take away the tenderness and the pain, and promote healing. But we also believe, however, that the alternating hot and cold foot bath is superior. And the reason why, again, is because you're bringing new blood into the area and the old blood is coming out. So what does that do? It creates circulation. So when the new blood comes into the area, it's bringing nutrients to heal faster. So the hot and cold to me is the best, one of the best. I like doing fomentations, but sometimes that can be a real chore because that's a lot of towels, it's a lot of work. But if you're using hot and cold and you're putting your feet in the hot water and then you put it in the cold water and you go back and forth, or you're doing the arm, the hot and the cold, it's amazing. If you want to be healthy during this season, the best thing you can do is take a 3-minute hot shower and then do 30 seconds cold and then 3 minutes hot, 30 seconds cold, 30 minutes hot, and then 30 seconds cold. And what does that do? It gives you an overall hydrotherapy treatment, so then that way you can stay healthy, well, and ready to go for your day. And so it will definitely wake you up when you get the cold on. But as you continue to do that, you will be amazed at how well that really does. So talking about sprained ankles again, you would use 3 minutes in the hot tub, as described, and then 30 seconds in the ice cold water with ice cubes, right? And the cycle should be repeated until the pain and swelling subsides, which may take 1 to 2 hours or more. very important that we do it right away. If the longer we wait, the longer it's going to take to help with that process. So the alternating hot and cold promotes healing. It stops hemorrhages. It reduces swelling, and it relieves pain. Do we have water? We have water everywhere. And so heat it up. So you got the hot water, and get some cold water. You can freeze it in little plastic containers or little plastic bags. Freeze it. Do what you need to do. Make sure that you always have this on hand, because you just don't know. I remember once I was going to a Bible study, and the lady just wasn't feeling good. She wasn't a diabetic, so I gave her a hot foot bath. And so instead of having the Bible study, I was ministering to her needs, her physical needs. And so as I did that, she started feeling better. I started giving her some water, and she felt so good after that. So these are some simple things that we can do. Increase the body temperature by 1 to 2 degrees. Profuse sweating may result because, the hot of that hot foot bath. Very desirable reaction, of course. It removes toxins and waste when we sweat, so that's very important. Remember to drink plenty of water so that the organs are excreting and that they're getting rid of some of these things, and have generous quality or quantity of the vehicle for eliminating the waste. So when we drink in water, it helps get rid of the waste. As the temperature goes up, the control mechanisms of the temperature in the brain changes gear. And what happens in the brain is that the person who starts out with a fever, they end up with normal temperature, and it rarely fails. So this is one thing that is really good as well. I know that I believe it's sambung, which is a herb. It's very good if you have a fever as well. Drink 3 to 5 cups of that if you have it in your area. But if you don't and you can't find it, a hot foot bath is the way to go. So here's a summary of hot foot bath. It's good for a headache because it increases the blood flow. Chest congestion because it helps with the temperature. The pelvic congestion because it helps with the increase of the white blood cell activity. And it's also good to warm a person up because it helps relax the muscles. So doing a hot foot bath is one of those go-tos when you're helping people with a number of different things, especially anything from the head and down. Sometimes even when people have a headache, just by putting your hands in hot water. So you're doing a hot hand bath. And so you just put your hands in that hot water for 20 to 30 minutes, making sure that the water continues to stay warm. And that too helps to get rid of the flow of the blood caught here in your head area, and it comes down to the hands. So what's happening in the body is simply this. So if we have our blood vessels like this, if this is normal, what happens is it gets like this, and so the blood gets trapped into the area, meaning there's really not much circulation going on. So when we put cold to the area, or we put heat to the area, it opens up the blood vessels about 40%. And then when we put cold in the area, it constricts the blood vessels. So what's happening with the hot and the cold is doing this kind of a process. It's opening and closing, so then that way the blood can have better blood flow. So that's why circulation is probably one of the most important things. That's why I started out with the 8 laws of health, because drinking your water is a very key thing. If you're not getting enough water, then all your organs will be sluggish and they won't be working like they should. You might not be having bowel movements, but if you're exercising as well, that's going to help with the whole process too, to have good circulation. And then of course, if something happens where you're not feeling good, doing a simple treatment like this can be amazing. So yeah, so at this time we can show how to do that too.
So I'm excited for that, Dr. Julie. But before that, talagang ito pong tubig ay napakahalaga. Kaya nga tubig, it flows, no? So the circulation, it is really very important in our body. Internally and externally, this water really help us in the good circulation of our body. Kaya po, sa ating pagbabalik, ay ipapakita ni Dr. Julie at meron tayong kasama pa mamaya, si Ma'am Eli, para ipakita po itong mga ilan sa mga hot and cold foot bath and even some of the cold and hot compress and gamit po ang tubig because water is medicine. For the meantime, panoorin po muna natin itong ating ginagawang programa dito po sa Adventist Medical Center Manila na next year ay batch number 14 na ng ating Lifestyle is Medicine Intervention Program. Panoorin po natin itong ating We Can Help You video.
Are you suffering from heart disease, diabetes, hypertension, obesity, stroke, anxiety, and other lifestyle diseases? We can help you. Join our Lifestyle is Medicine Intervention Program. This is a 6-week virtual health program, Tuesdays and Thursdays at 6 to 8 p.m. that will bring your lifestyle doctors and dietitians right where you are. There will be scientific evidence-based lectures, health screening, cooking demonstrations, workbook, and recipes that will help you in your health journey. Find out what is the optimal nutrition for your health conditions and activities fit for you. This holistic lifestyle intervention program will help you and your family to experience the best life in the midst of uncertainty and stressful living. Contact us at Adventist Med Lifestyle Medicine Facebook page for details and registration. Join now!
Sa atin pong pagpapatuloy, sa atin pong ginagawang talakayan sa hydrotherapy for common illnesses today, no? Sa ating panahon po ngayon na Nobyembre, Disyembre, ng mga taglamig na ito, no? Ay dadako na po tayo sa demonstration, no? Ipapakita po ni Dr. Julie Hayek ang ilan sa mga kaparaanan kung paano po ito gagawin at ano ang mga nagagamot. For what are this hydrotherapy for? What illnesses that they will heal for us and what good it will give us as a benefit. So now, let's give the time to Dr. Julie and kasama po natin si Ma'am Eli dito ng ating Lifestyle Medicine Department. Dr. Julie.
Yes, so what we're going to be doing is we're going to actually demonstrate so that way you can see how easy it is to do. All you need is some water. You need ice cubes and you need hot water to do these treatments. So the first thing that I'm going to start out with is a hot foot bath. Very important, easy to do. So we want to make sure that we have a basin. If you have two of these, that's great because one is for the cold and one is for the hot. So
Palanggana, yan.
yes, so basically I have somebody here. And so we have a big pail. So what we would do is we would make sure that we could put their feet, maybe put this up a little bit, and we would put some water in there, not too hot yet, so we would put their feet in there. Go ahead and put your feet in there.
Po yung paa sa timba.
And so what we're doing is that we're going to heat this up. But actually, what I like to do when I do this is I like to use a sheet and a blanket first, so that way the whole body is going to be heated. You can do it this way as well, and you can wrap a blanket around them, so then that way the heat is not coming out from the pail, so it stays warmer faster, longer, right?
Okay.
So we would drape them around like so. But what I would do first is if you can just stand up for a moment.
Stand up.
Yep, stand up.
Yan, tatayo po si Eli.
And then we would take we're going to use this first. And then I think I'm going to wrap that around because it's kind of short. So we would take this first, and we would wrap this. So then that way we can wrap it around them.
Mhm.
So now you can sit down,
Sit down, paupo na para hindi nakalabas
and you'd put your feet in the water.
yung init.
Yes, in it. And then what we do is we wrap them with this sheet because we want to keep them warm.
Mhm.
We want to make sure that this is going to stay warm as well.
Dahil kailangan po natin panatiliin na mainit yung tubig at para hindi siya madaling lumamig ay ayan.
And then what we're doing is we're putting this around them as well.
Yan.
So what we're doing is we're keeping everything warm. So this water will stay warm longer because 20 to
Yeah.
30 minutes. And so we also have a washcloth. And this one here would be ice cold. And we would put it in there and we'd squeeze out the excess water. We'd put it over
Malamig na tubig
head.
sa ulo. Ayun.
the head area, maybe over the whole head. But for sure we want to make sure that this stays cool because what's happening here is that the water or the head that's congested, it is cold, so it's taking the blood out of the area and it's helping it to go to where the feet are. So every so often what we're going to do is we're going to check to see how this is. And what we'll
hot.
do is we'll mix it up a little bit. And if you have one of those hot, like a pitcher that you plug in, those are really awesome. So what I would do is I would put my hand here, make sure that their feet are off to the side. So when I pour it in, I'm not going to scald them. I'm just pouring it in here. If anything happens, it's going to touch my hand and not them. So I'll be
Okay.
pouring the water in
So
and then
dahan-dahan.
mix it around. And then after that, then it seems pretty hot. Okay, they feel
Balik na
good.
uli. Yan.
Make sure that you're paying attention to make sure that they're feeling good. And then every so often, you're going to take
Palitan.
the washcloth
Babasahin
off
uli.
their head.
Yan.
and squeeze that out.
So this is very
Put
good
it
for
back on.
headache.
Very good for headache,
Yeah.
for congestion, for sore throat, for chest, for anything in the pelvis area or the stomach area. So this is all helping get the circulation flowing. So very simple, very easy to do. Messed up your hair a little bit. So another thing, if you want to make it into a steam,
Steam bath.
like a Russian steam, this is actually an emergency or a when you go camping, you can buy these. This is part of the kit that I put together for the places that I go to. So if they don't have any of these, if they don't have any of these things, so what you're doing is you're wrapping this around. And so once you have it wrapped around the whole area, you will have like another pot of really hot water. And you put it underneath the chair area so it'll heat up the whole area. And you want to just keep making sure that their forehead
Yeah.
and their head is cool.
Because this material absorbs heat. Yeah?
Yeah, and if you're outside, like say you're camping and someone gets sick, what are you going to do? But if you can boil some water, put that pot underneath the chair, you can soak their feet at the same time in warm water too. And when you put this around and the sun is out, it's going to make it even hotter. So the sun is also going to help with this to be heated up. So it's a very, very easy procedure. And what you're doing is you're giving them a steam bath. You're giving them a Russian steam bath.
Yeah. I can imagine the perspiration, the sweating that
Right.
will happen to the patient, no? Pagpapawisan talaga, no?
Right. Yeah, it's like whenever we're sweating, we're getting rid of the toxins. So that's
Yeah.
very important. Now this here,
What's
every
that?
time I fly to these other countries, they always give you like a little, see
Pouch.
this, the Philippine airline. How awesome, right? So they give you they give you a pair of socks. So what I do is I like to put extra little things in there because just in case, because I talk a lot, don't want to get a sore throat. So what you do here is, if this is our cold water that's ice cold, you take one sock, you put it in that ice cold water, and then you squeeze it out. Can you put your hair up? So this is ice cold. This is called a heating compress. But it's ice cold. And so
Malamig
what I'm going
siya.
to do is I'm
Malamig
going to
siya,
put it
pero-
around her throat.
Uh-huh.
Okay. And then I'm going to take the plastic wrap and I'm going to put that around her throat. So that's going to keep the coldness in, right? And then I'm going to put the other sock around that to hold that in.
So from cold to heat.
Yeah, so it's called a heating compress. Now, why is that? You wonder why it's called a heating compress? Because all of these remedies is to help assist the body in its healing process. So when we put cold to this area, what does cold do? It takes the blood out. So it's constricting the blood, taking that blood out of that area, and then the body heats that up and it brings new blood to the area. You can keep this on overnight and you're going to feel great the next morning. Very easy, very simple to do.
Wow.
Another thing is if a person, you want to do like fomentations. Now this takes a little longer. It's about 5 to 7 interchanges. And you'll keep it on, well, it depends on what your heating unit is. I like using a microwave for this. But if you have sand and you have good quality material that's a little kind of breathable material, but yet it's like canvas, I would say sew up little things, put the sand in there, sew it across, and it's going to be easier to heat up because what it does is that when it heats it up in the water, you can use that for like 4 to 5 interchanges, like 5 minutes each. So if you don't have that, but you have water, if you have a small towel, you're going to have some other towels too. You actually need quite a few towels. What you'd have to do is you'd have to take a few of these towels and you would get them wet. You squeeze out the excess water, and I usually roll them up. And say you have 2 of these, right? You have 2 of these that you got wet. You rolled them up, and you put them in a plastic bag, and you put them in the microwave. If you can't do that, then you can either get hot water, and you would put them in there, and when you do that, you want to put your hands like this, and then you put it in the hot water, and then you twist this.
Because it's hot.
Because it's hot. And so you're twisting it, and you're getting rid of all the excess water.
Okay.
So once you get rid of all the excess water, what you're going to do is you're going to place it inside a dry one.
This is for hot compress, yeah?
This is a fomentation.
Foment.
So if the person was lying down and they're having chest, we would put the hot compress here. We'd also put one on their back and then have them lay back. So we'd put one in the back, and then we'd keep that there for the whole time. And then our other one that we would do is once we dip it in that hot water and you're getting it all squeezed out, then we're putting it over here on the dry one, because the dry one is to help keep and hold the heat in. So you might say, okay, let's see,
Para mapanatili
we
niya
can
yung
take
init.
one less and we're going to put it in the chest area.
The chest.
Now here's the thing, if you're going to do this, you don't want the heart to get hot. So you may have to take a cold rag, put it over the heart area, and then put the rest of the heat. Because we don't want to do anything that would damage the heart, right? And then also you're going to squeeze and make sure that they got that. Whenever we're done with any of these treatment, like the hot foot bath, the Russian steam, or even the fomentation that we did, what we want to do is at the end, we're going to take the cold and we're going to go through their whole body and we're going to do the cold. So once we do this and we take their feet out, we're going to pour some cold on their feet. And then what we're going to do is take the cold and we're going to rub every area. And then we're going to wipe that. And then we're going to rub the area and we're going to wipe that. We're going to rub their arms and we're going to wipe that. We're going to rub that side. We're going to rub their chest and wipe that. So the whole body afterwards, we're using the cold with that. So these are simple things, but it takes time to do. And that's the thing why we don't use these type of things in the hospital. Because my dad had a massive stroke. And when we went to the Mayo Clinic, I went to the physical therapy department and I said, why don't you do hydrotherapy? The lady said, oh, it doesn't work. And I said, no. The truth is, you have too many people here And so you can only work with so many people at a time because there's only one of you and there's 15 other people. And so once my dad got out of that hospital, that was the second hospital he was at, and the third hospital where his doctor was, I went in and I asked him, I said, I want to be part of the medical team. And so I told him what I wanted to do, and he said, well, you know, miracles happen, they just don't happen that often. And he said, go ahead, that would be fine. So I did the fomentation packs to my dad's arm. I did it to his arm, and I did it to his leg that was having a problem. And then I did a massage, and then I did some stretching because I went down to physical therapy, and I asked them, what can I do to be part of the team to help you, because this is what I will be doing. And she was just like, wow, the doctor said you could do that? I said, yes. And so I started doing stretches as well. And in 1 week's time, my father went from walking where someone was holding him on each side, the front and the back, and they were kicking his foot through. And in 1 week, my dad went from that, which wasn't really walking, to walking on his own with a Hemi walker, with nobody kicking his foot, nobody pushing him or holding him up to have him walk. He did it on his own. So nobody can tell me that these simple things that God has given us doesn't work. I've seen too many times over and over and over again that it truly does work. So if you want to make sure it works, make sure you pray before you start the treatment. And when you do, you will see God's handiwork in all of that, His power to restore your health. So these are the keys that God has given us. The more simple the treatment, the more you know that it was God that does the healing. He is the great physician. He's my boss, and I'm so glad that He is, because He knows just what it is that we need.
Okay, thank you so much, Dr. Julie. And of course, thank you, Eli, for being our model. And talaga naman po, napakaraming nating pwedeng gawin at magagawa ng tubig, ng tubig sa ating mga kalusugan. Mapainit, mapamalamig, at syempre sa pag-ininom natin at sa labas ng ating katawan. Yan po ay napakalaki ng idinudulot na kagalingan at pagpapalakas ng ating mga katawan. So, before we ask Dr. Julie for a word of prayer, probably we are going to ask you for some of your parting words regarding this hydrotherapy for common diseases.
Yeah, so if you want to make sure that everything is working properly, like I said, make sure the 8 doctors are visiting your house every single day. Make sure that you're eating food that's going to give you the strength that you need. Make sure that you're exercising so that way every muscle in your body is doing its job. Make sure that you're drinking the amount of water that your body needs, so then that way you can fight off more infections and any type of situation that might be happening around you to help you through with that circulation. Making sure that you're getting your sunshine, because we need that sunshine. Vitamin D is so vital, and it's linked to so many different diseases. Make sure that we're breathing our air, and make sure that we're temperate, meaning that we're not overdoing the good stuff and staying away from those things that are harmful. Making sure that we're getting our rest, 7 to 9 hours of rest every single night that's uninterrupted. So then that way we can be on a schedule. That way everything is working in our body the way it should be. And making sure, most of all, the most important thing is trusting in God. God is the one who created us. God is the one that loves us. God is the one that heals us. He is there for us. Doesn't matter what's going on. He said He would never leave us nor forsake us. He will give us the wisdom that we need for whatever problem or situation that we find ourselves in. He will help us along the way. So don't worry. Give it to God. Let Him help you with the simple things that He has given us, like these water treatments.
Thank you so much, Dr. Julie Hayek. And now we are going to ask her, Dr. Julie, for a closing prayer.
Let's pray. Heavenly Father, I just want to thank You so much for providing just what it is that we need for every situation. Whether our health is good or bad, You have the remedies for us. I pray, Father, that we can truly be a person that can take advantage of those 8 things that You tell us to do, those 8 doctors that visit us every single day. I pray that we're open to do those things, And when things do get rough and where we might have had a mishap of maybe we're working too much, we're not exercising, we're not drinking enough water, we're not eating right, sometimes we have to do some other things in order to get back on track. So Father, I thank you for these simple, simple remedies, the compresses, the heating poultices, all these things that you have for us with the simple things of water. We thank you, Father, and we praise you. We give you all the glory because you are the great physician, and we want to thank you for that. I pray, Father, that you will help all the people that are listening to be able to utilize these things and to apply it in their lives. We thank you, for it's in Jesus' name. Amen.
Amen. Amen. Thank you so much, Dr. Julie Hayek, coming all the way from the other side of the world and blessing us, helping us, many people, maraming tao po dito sa Pilipinas. At sa tingin ko, marami po talaga ang makikinabang. Kaya i-like, i-share natin itong mga to na kayang-kaya po natin gawin sa ating mga tahanan basta meron tayong tubig. Because hydrotherapy, fluid, water is medicine. Kaya po, thank you so much, Dr. Julie, from all of us in this program and from all of our listeners and viewers. Kaya mga kaibigan, patuloy niyo po kaming subaybayan tuwing Lunes, Miyerkules at Biyernes dito po sa inyong programa, Voice of Health Pilipinas, tinig ng kalusugan, trumpeting heaven's prescription that lifestyle is medicine. Nawa, patuloy po tayong mag-enjoy ng isang malusog, malakas at masiglang mga pangangatawan at healthy lifestyle. Salamat po and God bless you all.
This is the Voice of Health. This is the Voice of Health.